Okay. Rachel, are you happy?
Am I ready to go? Yeah, tell me when
to start. So. Yeah, I think that'd be great. Yeah, thank you.
Okay, a very lovely warm welcome. This is a session about carbon literacy training for healthcare. Very happy to introduce two speakers today. Aisling is an experienced musculoskeletal physiotherapist based down in Cornwall, who specialises in working with those with connective tissue disorders and became involved in sustainability after completing the carbon literacy for healthcare training in 2021. And has since created the physiotherapy specific carbon literacy training course, which I can definitely advocate for because I've been on it and it's great, and now teaches therapists around the world. And Helen is the healthcare and blue light coordinator at the Carbon Literacy Project. Helen has experience with healthcare within the healthcare sector, working as a critical care nurse, predominantly in the field of neurology and neurosurgery, and holds a BSc in environmental design and management. I think it's probably good to go and start the presentation. We'll do a little bit of housekeeping to begin with. If we could...
Shall I share
the slides?
Yeah.
I should probably also say my name's Rachel. I'm a physiotherapist and I'm here facilitating the session. So just to let everybody know, we're recording the session today. It'd be great for people to interact with in the session as much as possible. So please do make use of the chat. I will be looking at the chat and picking up on any questions. There'll also be a Q&A session at the end. So we'll follow that. Please get involved and stuck in. Please keep yourselves on mute so that we can minimise any interruptions. And I think we're good to go.
Great, I will share the slide.
Great, thank you.
Right, can everyone see that all right?
Yeah.
Yes, it's not in presenter mode for me yet. Great. That looks good. Thank you. So okay, great. So Aileen and I are going to co-present today, and the first part of our presentation is my bit. So I've already been introduced, and so what I want to do is, for those of you who are not familiar with carbon literacy, just give you a bit of a walkthrough of what carbon literacy is and why it's relevant to healthcare. So we can move on, please. Thank you. That's my dog shaking himself, sorry. So the Carbon Literacy Project, what is the Carbon Literacy Project? It is a low carbon culture change project based in Manchester, promoting climate action where you are, and that's really important. It's a non-profit charity operating out of Manchester, but locally and globally. So we have carbon literate individuals now all over the world in all different sectors, not just healthcare. We oversee the expansion of the project and carbon literacy training across UK, Europe and internationally. We were recognised back in at COP21, so quite a while ago now, for one of the top 100 worldwide transformative action programmes for climate action. Thank you. So what is carbon literacy? This is really important because it's really important for everyone to know what the basic element is of carbon literacy. So it is an awareness of the carbon costs and impacts of everyday activities and the ability and motivation to reduce emissions on an individual, community and organisational basis. So it's not teaching you how to do a carbon audit. It's not helping you measure emissions. It's an awareness and an understanding of carbon, of what's happening to our climate, of the impacts of carbon emissions on everyday activities, and the knowledge and ability to take action within your realm, within your role at work, within the home, and as an organisational basis and in your community. Thank you. So key aspects of training, it's always a day's worth of training, which is quite a long time, but we have a carbon literacy standard, and that has been designed to make sure that everybody has the same baseline knowledge of climate change, understanding what the links are between climate and health and the co-benefits of action, and then understanding how to take that action. And learning is always relevant to the individual, and it's taken to where people are. So, for example, Aileen's course is designed for the context of physiotherapy. So it's always best to be delivered peer-to-peer, where people can see real examples of how they might take actions within their profession or department. There is an accreditation process, so that ensures that it is a formal part of training, and ensures the quality of the standard of the training and the fact that people can then use that as an accreditation. So it is a £10 fee per person for NHS colleagues, and then for other organisations it could be a little bit higher. Thanks, Aileen. So what does it do? Carbon literacy training enables you to understand the basics of climate change, understand the relationship between climate change and health, the current and future impacts of climate change, and the co-benefits of action. It helps you gain knowledge of climate policy, and that's global, local, and within your within the NHS and within your trust or wherever you're working. And it helps you turn policy into action. So it helps bridge that gap between policy and action, because many of us know what we should be doing, but we just don't know how to do it. And the training also has customizable elements where you can showcase examples of your action within your sector. And the training is really important to help you build confidence in communicating climate change to others, and also communicate action with others, to help you engage with stakeholders, talk to patients about climate change, and also leadership. So yeah, it's really important for communication, helping you build those soft skills that you need to maintain your resilience when you're working in this field. Thank you, Aileen. This is an out-of-date infographic because it's normally out of date, because at the moment we have over 92,000 individuals certified, multiple sectors, so not just public sector, but we have like all sorts of sectors involved in carbon literacy. We have a suite of toolkits designed for those sectors, and one of the most important figures to point out from that infographic is the 5 to 15% carbon savings per person, and that's the potential carbon savings that an individual can make once they have become carbon literate. And that was some research done by Jacobs Engineering a while ago, and so that's kind of evidencing the real impact you can make to your carbon reduction plan by empowering people with carbon literacy. Please, can you move it on for me? Thank you. So there is a standard to inform how carbon literacy is delivered, to make sure that it creates the value that is intended. And so there's a day's worth of training, as I've described. That is broken down a little bit within the healthcare toolkit, so it becomes a bit more accessible for people who are very busy. But it's all about local learning delivered by peers in a positive way. So climate change can be very unpleasant to learn about, and it's really important to take people on a journey where they understand the realities of climate change and the impact it's having, but then also what positive action we can take. So learners do leave the training at the end of the day feeling like they have got agency to take positive action, and that's really important when we're considering climate anxiety and health and well-being. So the standard has values about how collective action makes a difference for a better world. And it's really important that we consider equity and fairness. As we all know, we are not all experiencing climate change in the same way. There is inequity in how people are experiencing climate change and what effects are happening globally. Knowledge is really important, so we can't make informed decisions until we have the facts, and the facts are really important, especially in the political environment we're in, where we see the weaponizing of terms like net zero. So it's really important for us to have sound facts and knowledge around carbon, around carbon and climate change, and have that language that we need to communicate to others, and we're clear about some of the definitions. There's a big focus on action. Like I say, most of the second part of the training focuses on action and how we can collaborate with our peers, whether that's within our departments or within cross-departmental collaboration, where we can think about innovation, where we can think about problem solving and kind of unpick some of our processes and systems and think about how we can embed sustainability and reduce the emissions. And I think that is the really we can all learn about the knowledge, but the action part of the training is where that real kind of those light bulb moments happen. And there's a process as well. So there's a criteria checking process. So at the project, we have a team of people working on checking the pledges, we call them. So those actions people commit to at the end of their training are thoroughly checked by our teams, and many of them are shared with us internally, either anonymously or with permission, so that we can see some of the amazing actions people are committing to in all sorts of sectors. And obviously we see some of the healthcare ones as well, which are amazing. So there is a certificate kind of process at the end of the training. We also have a toolkit license, so the healthcare toolkit has a license attached to it, and that is funded at the moment by NHS England until 2026. And that's really important because that means that for NHS colleagues, it's free to access for that period. So that's the main kind of core elements of the standard, just to cover for you. Thank you, Aileen. So why carbon literacy for healthcare? Well, I mentioned that 5 to 15% carbon savings, helping you embed low carbon decision making, translate green plans and policy into action, increase efficiency and cost savings, increase staff engagement and motivation to reduce emissions because you feel more empowered to take action, and build confidence to communicate those actions. Thank you. Some of the partners we've worked with to develop the resources, and they're not all on here, they won't all fit on the slide, but just some of the main ones at the beginning of the process. So this toolkit was developed in collaboration with NHS England and Green at NHS and is approved for use by them. Thank you. So what's in the toolkit? What is a toolkit? So it's sector specific, adaptable. It's a complete course kit for the sector it's designed for, and anybody can use it to deliver training. And that's really important too, because it is there's a very flexible approach to how you can use these resources. Thank you. So in the toolkit, you have access to a trainer manual, a slide deck, an activity pack, a resource list, getting started information, and the evidence forms you will need for your learners. So once you are carbon literate, you can request access to the toolkit from our team, and then we host delivering successful carbon literacy sessions, just 1 hour webinars to help you learn how to deliver training yourself within your context. Thank you. So within the toolkit, there are 3 courses available. There's an e-learning pathway, which has been designed to be very flexible to help colleagues who are, time strapped like everybody is, but it's 5 modules of 30 minutes each, all accessible on the NHS Learning Hub with an NHS email address or an Open Athens login. And you can take these modules in your own time, asynchronously, just 30 minutes each. And at the end of each module, you do a small assessment to move on to the next one. And that covers all the basic information around climate science, a relationship between health and climate, and some of the policy information. And I would recommend that pathway for anyone who needs that flexibility. But also if you've done the 30-minute introduction to sustainability session that's offered at the moment by the Centre for Sustainable Healthcare, this is a good kind of thing to do next. And then it's an accredited scheme, as I've mentioned before, designed by and with sector professionals, free to access for NHS organisations. And there's a cascading approach to training. So if anybody becomes carbon literate, like I said before, they can do this short 1 hour webinar, and then they can think about how they want to deliver within their department or trust, and cascade carbon literacy. Or you can ask Aileen and she can put you on one of her courses, and the same thing can be achieved. So please move me along. Thank you. So this is an example of some of the slides, and these are talking about action. So this is part of the training where you are supported to think about what actions you can take individually and a group action. And these are really empowering, and you can think about whether how you select like a medium or a low, medium or high carbon impact action, and think really ambitiously about how you can make positive change within your realm, I mean within your role. Thank you. And so this is an overview of the process. So one of you becomes carbon literate. You attend a session with us. We ran one of them yesterday just for an hour. We will talk you through the process of delivering training. You can organise a pilot within your organisation to deliver your first session. We will support you with that. Or you can ask Aileen and she will organise that kind of session for you. Next slide, please. That's fine. Then you gather the evidence from your cohort, you send that in to us, and you can then have 10 to 15 people trained in carbon literacy, and then they can then start delivering carbon literacy themselves. So obviously there are vast numbers of people working within healthcare, and so there's an opportunity for the cascade to happen rapidly if we increase the number of carbon literate individuals. And we also have a series of accreditations for organisations. So if you wanted to be a carbon literate organisation, that's a really nice way of demonstrating your commitment to net zero and embedding carbon literacy within your team or trust. And there are different levels to that depending upon how much you have engaged with carbon literacy. But yeah, have a look at that if you're interested. Thank you. And that's my bit done. So I'll hand over to Aileen. I have delivered carbon literacy training, but not to a healthcare audience. So I'm looking forward to hearing more about how Aileen's actually doing that and has been doing that successfully.
Thank you, Helen. Sorry, I just had to unmute myself, and I'll go back to the back to the presentation. Okay. Right. Okay. So as we heard from Helen just now, the first part of the definition of carbon literacy is an awareness of the carbon costs and impacts of everyday activities. So let's just consider this for a minute. What are the effects of climate change on health? Here in the UK, for example, when we consider things like air pollution, heat waves, storms, flooding, and fires, we've seen an increase in all of these things over the recent years, not to mention all the storms and flooding and everything we've had recently. And we know that this is largely attributed to climate change. And they all have a direct impact on us and on our work. We saw, as it shows here, huge increases in the number of admissions due to heat waves, for example, over the last few summers. As well as causing increased hospital admissions, the heat waves also do lead to an increase in the incidence of stroke. As it says here, every 1 degree increase in mean temperature during the preceding 24 hours was associated with a 2.1 increase in ischemic stroke admissions. If we take air pollution, we know that long-term exposure can damage the heart, lungs, blood vessels, making the person more likely to develop things like heart disease, strokes, as we say, asthma, COPD, lung cancer, the list goes on. And if we consider things like flooding, obviously there are commonly huge economic costs associated with the damage caused by floods, but often we're looking at a slightly different kind of impact where we're looking a little bit more at mental health. And here we can see that flood victims are up to 4 times more likely to suffer mental health issues, and almost 1 in 3 people reported suffering from PTSD after their home flooded. So if we think about those of us who are young and healthy, or believe that we're not affected by these things, let's just think about how we exercise, how we travel outdoors. We've got these things we're considering are hugely important. We where we decide to swim outdoors, for example, with regard to polluted waters, or what route we take to travel to work by foot or by bike, and with regards to vehicles around us and fumes, exhaust fumes and things. So these environmental considerations then come into what we as professionals should be advising to our patients as well. So yeah, just a little bit of information here. Did you know that NHS England is responsible for 4% of England's total carbon footprint? 1 in 20 vehicles on the road in England are attributed to the NHS. And so that's obviously going to be things like, emergency vehicles and things, but also things like transporting goods and services. So 1 in 20 vehicles, I think, is huge. But the NHS is aiming to be the world's first net zero national health service by 2040, which is fantastic. So I know Helen used this just on one of her slides a moment ago. Some of you may have come across this image before, but it just basically shows in a bit more detail how we break down the NHS's carbon footprint. The Scope 3 emissions, the blue sections, also known as indirect emissions from the NHS, you can see there's a huge part of that that's attributed to medicines and chemicals at 20%, medical equipment at 10%, non-medical equipment significant too at 8%, which would be things like computers, phones, fridges and things. Other supply chain at the bottom is huge, 24%, which includes things like manufacturing and delivering of goods and equipment, catering and procurement, accounts service, IT, phone service, those sorts of things. And then we go on to the Scope 1 and Scope 2 emissions, which are the green ones, which are a combination of both direct and indirect emissions from activities in the NHS. And we've got a big section on building energy, waste and water, and then business and fleet travel. Anaesthetic gases and metered dose inhalers as well make up 5% of the total carbon footprint. And then our Scope 4s, which is the visitor, staff and patient travel. And then a small section at the top on other commissioned health services outside of the NHS, like private services. So where are healthcare professionals at generally in the UK then? What are we looking at in terms of how aware and involved healthcare professionals as a whole are? Well, there seems to be this universal awareness that climate change is real and is happening now, and an awareness of the direct impacts of climate change and about the areas of action that can be taken to reduce our personal carbon footprint. However, it seems to be that there is variable awareness still about the urgency of the need to transform society and the associated risks if we don't, and about the connection with health, healthcare, health priorities, and about the connection with one's clinical role as well. So the NHS is one of the biggest employers in the world. It has a huge carbon footprint, as we already know, and allied health professionals are the third largest group of professionals in the NHS. So we really need to consider our own carbon footprint and look at our role in contributing to the net zero goal. And obviously this varies somewhat depending on which AHP we're looking at. For example, you could argue radiography could be seen as quite carbon intensive due to the use of X-ray and scanning machines, paramedics as well with the travel vehicle component. Physiotherapy has been labelled as a green health profession overall, as it says here, with its emphasis on low-tech, hands-on and interpersonal approach to therapy. Physiotherapy can rightfully claim to be one of the more eco-friendly approaches to healthcare. If we think about it, we increase mobility and fitness through injury rehabilitation, therefore enabling active participation in social life and the natural environment. We facilitate and encourage the use of active transport, like walking and cycling, and we reduce the need for medications and resource-intensive healthcare. However, there is always more that can be done in reducing our carbon footprint and helping to meet our NHS targets. So with that in mind, I'd like to just do a quick activity, or I'd like us all to do a quick activity, if that's all right. So we're going to think about the main hotspots in your role and your place of work. So what are the areas of your job that are the most carbon intensive? And we're going to look at them under 5 different headings. So we've got travel, energy, services, procurement, and other. So I'm going to bring up a Padlet slide now. So this is what it's going to look like. So carbon hotspots in healthcare, and these are the 5 titles. And I'll just put an example on each of those just to get started. And if Rachel, if you could pop the link to this page on in the chat, that would be great. And then if you just simply click on the link, it will come up with this page, and then you can just add comments. You can just fire away. So I am just going to come out of screen sharing for a moment. And let's have a look at the chat, or I can pop that in as
the link.
Oh,
it's
sorry.
already been shared. Sorry.
Oh, great.
Yeah, the link's there.
Oh, brilliant. Thank you. If I come back to the page, great. We've got some things starting. So I'm going to share the screen once more. Here we go. So yeah, as I say, anyone can pop some things on there, and you can all see what everyone's writing. And what we're going to do as well is save this page and put the link in it on the chat at the end, so you can all keep the information as well, which is quite useful. But yeah, some good ones coming up here. Yeah. Yeah, lights, computers, lots of different aspects to the travel side of things. Printed campaign promotion materials, that's a good one, yeah. Yeah, some great ideas coming up. So we're just going to spend just perhaps a couple more minutes or so just doing these. What's quite nice as well is that it often makes us think of ideas as well when you see what other people are writing. It's just useful to think about, to just, yeah, as we say, just increase our awareness about all of these things that we don't necessarily think about.
Some of them can be small parts of a role as well, but actually the collective impact can be huge if we all make one small change.
Absolutely. Yeah, because in some departments it can often feel quite hard, quite difficult to actually try and make a change. If you're just one person trying to encourage change throughout the department, and there's ways around that, and that's what part of the carbon literacy training the course includes is communicating about it and working on behaviour change and encouraging behaviour change and things. So, but we can't always do that. So, as Helen says, just things that we can do ourselves do help hugely. So, but yeah, there's some really nice ideas there. Well done, everyone. So maybe just do perhaps just one more minute. Radiators on and off at the wrong time of year. My goodness, working in the hospitals, that used to do my head in when it was so hot in the summer. Kettle is a wise one. I mean, needs must at the end of the day. But filling the kettle only what we need, not filling it full and boiling it full all the time. It's just a little simple thing that we can do.
Or having a boiling water dispenser, what are they called? the ones that you just pull and the hot water comes out and you haven't got to
Oh,
bother
yes,
people.
exactly. Yeah. Lovely. Let's just do the last 30 seconds or so. And what I'll do, I'll leave this. Well, yeah, if you want to keep adding to bits during the next bit of the presentation, please feel free. And as I said, we'll have this all saved for you. Okay, but no, really, really nice ideas there. Well done. I hope you all had a little chance to have a look at what some of you have been writing. So if I just come back now to the presentation. There we go. Okay, so had to think about what are the hotspots, what are the areas that are using up lots of the carbon. So what can we be doing about it? What can we be doing better as healthcare professionals as well as private citizens? So we can move better. So obviously that includes your active travel, we can drive less, walk or cycle to work. Can we even fly less or ideally not at all? I'm not going to stress that too much because holidays are important, but just thinking about the ways that we travel. We can eat better, so we can move from a high carbon diet, so things mainly like meat and dairy, to a low carbon diet, things like a plant-based one. We can buy better, obviously buying less, using our money more wisely, reducing our waste, divesting from fossil fuels, and investing in sustainable goods and services. We can practice better, so let's be more aware of our carbon footprint in the workplace and the potential strategies and ways that we can reduce it. We can campaign better, so let's take opportunities to engage with sustainability. Let's join organisations, make political statements. Quick mention now, I'm a physiotherapist, part of Physiotherapy Declares, a subgroup of Health Declares. Really great networks to be involved in, so do have a look at those. And we can talk better, so by learning more and being more aware, we can talk about the issues with our colleagues and our peers. As I said about, with the training, talking about the communication side of things and behaviour change, and also with our patients and the public, and explaining that this is a health issue as well as an environmental issue. If we look at some examples now of what departments around the country have been doing, this is a physiotherapy example from Frimley NHS Foundation Trust. They set out to reduce duplicate issuing of walking aids. So they introduced a new procedure whereby they asked patients or relatives if they had an existing or suitable walking aid at home already. And they created a checklist that could be used to enable relatives or carers or friends to assess if the existing walking aid was safe to use. They also increased the returns of walking aids to healthcare settings. The team investigated the local provision of collection points used for walking aids, and they generated ideas and methods to encourage patients to return walking aids to their nearest collection point. And over one day, as it says here, they saved 182 kilograms of carbon dioxide equivalent in carbon emissions, which amounts to an annual forecast saving of over 11,000.
Sorry to interrupt.
Sorry.
I think you need to stop your screen share and share the slides because we can only see the Padlet at the moment.
Oh,
sorry
goodness. Oh, I'm
Sorry,
so sorry.
I was I was waiting for the right time to interrupt, but there wasn't one. Sorry.
Yeah, so I just rudely interrupted. Sorry. Ash.
Oh no, I'm so sorry. I do apologise. So hang on. It was it was sharing the Padlet. I see. Sorry, FYI, I'm just on maternity leave, so I'm going to blame this on my maternity leave brain and not having done this for a few months. There we go. So you should all see the presentation again now. Once again, I do apologise about that. Right. Okay, so the next example then, Bart's NHS Trust. This is an example just recently published in our by the CSP, our physiotherapy governing body, where the physio team implemented a scheme to reduce inefficiencies in limb reconstruction care. And they embedded a specialist physio within its limb reconstruction service, followed by an evaluation of its environmental impact with support from Centre for Sustainable Healthcare. And they found that by upskilling the physio in external fixator adjustments, a specialist physio nurse duo were able to reroute the majority of frame removals from theatres into clinic, and the pathway change was responsible for an annual carbon footprint reduction of 19.66%. So that's over 1,282 kilograms of carbon dioxide equivalent, as well as annual economic savings of over 54,000 and over 74% positive functional outcomes. So that's fantastic figures. And then just quickly as well, example here from Centre for Sustainable Healthcare, where the dietetics team at Royal Devon and Exeter Wamford Hospital established and implemented a more effective management system for the supply and storage of oral nutritional supplements to help reduce the overprescription and waste and the financial and environmental costs that went with it. And there are lots of case studies on the Centre for Sustainable Healthcare website that you can have a look at. So second quick activity now, I'll try and do a bit better with the screen sharing, is another Padlet task. What can we do to reduce our carbon footprint? So strategies now. So if Rachel could
Yep.
just put the other
Just
link.
shared.
Is that done?
Yep.
Great, fantastic. And let's share this one. So that was one we just did. And this is the what can we do to reduce our carbon footprint? So just a couple more minutes again then. Think of any ideas, anything that you can do to, fantastic, cycle and walk, travel, yeah, to reduce our carbon footprint in any of those under those same headings. Brilliant. So how can we reduce what we use? Yeah, well done. Turn off PCs at the end of the day. Bristol Hospital, I think it is. Was it Bristol? Did the TLC campaign. So turn off the lights. No, turn off the computers, sorry. Turn off the lights and close doors. So T for turn off computers, L for turn off the lights, C for close doors. And it was just a nice campaign that proved to be really effective throughout the hospital, actually. Just little things like that. Big things also as well are great, but even the little things help. Yeah, lovely ideas. Well done, everyone. Yeah, ensuring suppliers are from green energy. That's a good one to look into. Obviously, it's quite difficult for us if we're not in the managerial side of things. However, it's, if we can highlight it and get in touch with the right people, the right departments, we can make these changes. Brilliant. Well done, everyone. Yeah. Really nice ideas. We'll just do one more minute. Virtual seminars where face-to-face contact not required. Exactly. And I think this week has been a great example of just what we can do, what we can achieve with all these virtual sessions. So last 30 seconds or so. Lovely. Education, exactly. Leadership training, yeah. carbon literacy training, you know, doing that cascading effect, training one person, they can then train the department. Great stuff. Okay, I'm going to come out of this screen sharing now and just go back to the slides once more. So a few ways here that you can also get involved, just ideas: visiting the Greener AHP hub, completing the e-learning that Helen mentioned, joining the Centre for Sustainable Healthcare Networks, idea there for submitting a case study as well, nominating for the Greener AHP Awards, visit your professional sustainability webpage, as I said as well, looking into the Health Declares subgroups. There are a lot of them now, or quite a few of them now, ways that you can get involved in you know, spreading the word and talking with like-minded people. So lots of ways that we can be getting involved. And yeah, there's some more links here that hopefully Rachel can just put up on the chat with the links to those getting involved ideas. So you can access those on the chat. Lovely. So let's come out of screen share once more. There. Okay, so all the links hopefully should be on in the chat there, and the same links will work to keep those Padlet pages. So just if you want to use them over, you know, we can leave those up for now. So just keep that link, copy that link, and you can see all the ideas that everyone's written. But thank you so much, everyone, for listening. And yeah, we'll open up question and answers as well. If I don't know if there's been anything going on in the chat questions wise, Rachel.
Yeah. Thank you both for a really interesting chat. It's always interesting to hear kind of stark statistics, isn't it? But I was having